Anna, hello. If you hear me, please answer. Let's check sound and video.
Hello.
Hello. Yes, it's okay.
Yes. Because I'm organizing everything here, so that's why I kept the camera closed.
Ah, okay, no problem.
But do you want me to open it to see?
No, now we can't because there is demonstration screen, another participant.
Okay.
But I want to tell you that there is some changes. One presenter will be not able to attend. It's the first participant. So all the speeches, all presentations are shifted up one.
Okay.
Okay, be ready.
All right.
Good afternoon, dear colleagues, and welcome to the Symposium International Experience of Young Medics Fighting COVID-19. This meeting is a unique event that emphasizes discussion and collaboration between medical students, young doctors, and educators of Russia, Slovakia, Indonesia, and Brazil.
We welcome all the participants of our session, all the mentors and speakers. Our session will contain reports which focus on experience of fighting COVID-19. This conference is all about learning from each other.
Before we start, I'd like to remind the speakers about the timing of your presentation, which should be up to 15 minutes. Also, I'd like to remind you that all of the presentation will be translated from English to Russian simultaneously. Please click on the interpretation icon, which is located in the menu down below, and select your preferred language.
And we want to notice that all the participants and listeners can ask their questions by using the form questions and answers at the bottom of your screen. We will read them and answer after the presentation or at the end of the conference. So we are starting our symposium with the first report. Please welcome Andrei Kolar, a student from Yesenius Faculty of Medicine, Comenius University, Slovakia, who will talk about his experience during COVID-19. Please welcome.
So I believe everything is working fine from my side. Can I get feedback, please?
Yes, it's okay.
Okay, thank you very much. So again, good afternoon, everyone. As was mentioned, my name is Andrei Kolar. I'm a third-year student of general medicine from Slovakia at Yesenius Faculty of Medicine of Comenius University. And in my today's presentation, I'll speak a bit about the experiences of young medic, which is obviously me during the COVID-19 pandemics in Slovakia. Unfortunately, one presentation connected with the overall state of COVID pandemics in Slovakia, but my colleague has been administered to hospital, so may she get well soon. And I'll just selfishly speak about my own experiences, but in the after presentation discussion, you can ask about anything, and I hope I'll be able to answer all of the questions. Here is the timeline of everything, of all of the events connected with COVID and me, and also this stands for the things I'll closely look upon at the following presentation. So as you can see on the left side, the first confirmed case of COVID-19 was on 6th of March 2020, and shortly after, not even a week, my university has been closed, following with all of the universities and pretty much everything in my country, for which lasts till today. At the time, I was not really sad of it, because I was just second-year student, so I could have learned everything via the online education. But since it continued throughout my third-year experiences, and which are connected really with the practical studies, I had to seek opportunities to myself, because the university was not allowed to let us go to the hospital. So I seek the work at my hometown hospital, where I have been working at the ICU. While working at the ICU, I have been infected by the COVID. But on the other hand, 1 month after, I have been vaccinated, which was pretty nice. And even though my experience at the hospital had to come to an end, I find out that one young surgeon has been opening his testing center at the firm of my brother-in-law. So I've already applied there as well, and I've been working there with my colleagues for a month, and therefore, even though it come to an end, unfortunately, I'm still even today testing the inhabitants of my village. Even this Saturday, I'm going to test them. I'll speak about everything closely. So to speak the subject at my university, as I mentioned, the university closed in March 2020 on 13th of March. And actually finally was reopened for 1 week of this winter course in September. But as you may or may not say, when you put young medics back after a few months of not seeing each other at the dorms, it is inevitable celebrations, and unfortunately 3 of my colleagues have been infected by coronavirus when they came to the dorm from home, and the meeting of everyone led to putting the dorm after 1 week of opening to the quarantine, and after 2 weeks the university was already shut down again, and we continued with our online distance education. On the left side, you can see my this week's schedule. As you can see, it's pretty full. There are a lot of courses and lectures. Pretty much every day I have something. And to speak, we are using the Microsoft Teams conference program, which was the logical way since my university has the office, so it was just a logical way to use their conference program. And to speak about the advantages and disadvantages, well, I believe the disadvantages are pretty clear. The lack of practical, since I should have all of the propedeutics this year, like internal medicine and the surgeries, which I was not able via the university. But not to be just so critical, every lecture and is recorded, so if you didn't catch something, you can pretty much rewatch it later, which comes handy at the pathology courses. On the right side, you can see me and my really good friend at the hospital at my university hospital. There is the logo of my university hospital, and we have been there not a month ago at the surgical department, surgery department, because the surgery department was so nice that they allowed even the students from the 3rd year to come and see what they are doing, their day-to-day work, and to actually see the patients after pretty much 7 months of education this year, not seeing a living organism. So, as I mentioned, I was not able to study the practical things at my university hospital, so I seeked out to help myself with this. So, in the October 2020, I've applied at my which is the Central Military Hospital in Ružomberok, and I have been working for 4 months, almost 4 months there. They have been so nice that they gave me this opportunity. Firstly, I have been working for more than a month at the COVID department at the internal clinic, which building you can see the photo, which was not that nice because when you think about it, there have been COVID ward open on pretty much every clinic, like anesthesiology and internal anesthesiology and intensive care, then obviously on the infectious disease department and so on. And every department had its own patients just infected with the COVID on their COVID ward. So pretty much there were been just the geriatric patients infected by COVID, and this inevitably leads to a lot of exitusis, so was not that nice. But afterwards, I have been working at the ICU, intensive care unit of the internal medicine clinic, which was pretty nice. I have been working there for almost 2.5 months. I have learned a lot from the examining the patients, and especially day-to-day work of the medical health professionals. And I'm really grateful for this opportunity. But unfortunately, on the other hand, while I have been working in the intensive care, pretty much probably because of my lack of cautiousness, I've got the COVID infection on the Christmas last year. On 23rd, I went to the work and I felt really badly. I have been tested by the nurse and came out I was COVID positive. So I went to 10-day quarantine back to home. But since I'm young and relatively healthy, I just a bit of muscle pain, higher temperature, and loss of smell, which didn't last that long. Compared to the patients I've seen at the hospital, I was pretty lucky. Not even a month after I've undergo my COVID infection, I have been vaccinated by the Pfizer-BioNTech vaccine, which I'm really grateful for. Again, I was one of the, I was considered every student, but I have been also working at the hospital, so I was considered the medical professional. So I have been vaccinated in the first wave of vaccination, and nowadays it continues there to vaccinate everyone according to age. We started with the elderly people, and actually today the waiting room for vaccination is open for everyone older than 16 years of age. And for my last experience during the COVID pandemics, there was antigen testing or work at the antigen testing center. It is really important under the line. In December of last year, every citizen must own a certificate of negative test result from antigen testing not older than 1 week, or PCR testing not older than 2 weeks. There are some exceptions. Pretty much if you are vaccinated or you are post-COVID patient, then you don't have to do this, but I won't speak about that in particular. So this leads to that the government of health had to open a lot of testing centers all around the Slovakia. If you want to test all of your cities, have the centers for it. So I was lucky enough that in my hometown, again in Ružomberok city, one young surgeon applied at the government to gain the opportunity to have the testing center, and it was opened in the building of my brother-in-law firm. So me and 2 of my other classmates have been working there as the testers. As you can see on the pictures, there have been also the administrative workers. That's me, I'm testing them. And on the first one, I'm in action working with the results of the test. And I have been working there for 1 month. Unfortunately, it has been closed because, let's be clear, it was pretty lucrative. So there was a greed from the competitors, and also the bureaucratic mistake of our surgeon led to closage of the testing center. But nevertheless, even today, I'm still testing because the mayor of my village every weekend on Saturday is open our house of culture, since he's so nice that he's providing this for the inhabitants of the village, that they don't have to seek another testing center in the city. So every Saturday we are testing our own inhabitants, and I'm working there every other or every third Saturday, since there are a lot of healthcare professionals in my village, and we are. This is all from me for my experiences and what I have been doing connected with the COVID pandemics. I hope you find it interesting, and if you have any questions, please don't hesitate to ask.
Thank you, Andrei. Yes, we have a question for you. How was the mandatory testing organized, and do you think it's necessary for all the countries to test all the residents of the country?
Well, very nice question. So how was it organized? I think, so to start with it, there was so-called all nations, where it was in the November of last year, when I think that really was helpful. Like there was also studies in the medical journals and so on about the Slovakia, because we were the first came with it. And it was nice because the military and the pretty much healthcare professionals tested the whole nations 2 weeks, and again tested them like everyone. So it was pretty nice because we catched up a lot of positive patients. It was like in one wave. But this long-term testing, I don't think it's really necessary for the country. And let's be clear, the Slovakia has like 5 million inhabitants, 5.5 million of inhabitants, which is one bigger city in Europe, and in Asia, it's not even a village. So it's not really difficult for us to do so. But I think it's a waste of resources, even in a lot of money are wasted. And how it's meant, you don't have to go there. But if you want to go to shop, to work, to school, pretty much if you want to leave your house, you should have this test, because if the police officer catches you, it is not common, but if he catches you, ask if you have the certificate, and if you don't, then you pay the fee, and pretty much may have another problems connected with the law. So why would someone not do so? And in the work, I know it's mandatory. Like if you go to the factory or to any other kind of work, then the employer is like mandatory to have their employees tested.
And do you think that it's necessary for all the countries? I mean, does it depend on the size of the country to test everybody?
I don't think so. Like, I don't think it's even necessary here, and I don't think after 4 months of continuous testing that is providing any benefits. But yeah, as I mentioned, the size of country is really relevant here, because like it's not a problem here. When you think about Japan and Tokyo, Tokyo is 6 times bigger than my whole country, so it would be really difficult, I believe, for them to do so.
Thank you, Andrei. I remind all the listeners that you can write your questions to the chat, and we are going to the next reporter. Please welcome Jonathan Fibianta from Pelita Harapan University, Indonesia, who will talk about perspective, experiences, and situation of medical field in Indonesia during COVID-19 pandemic.
Okay, thank you so much, Kate, for the introduction. Now, let me share my PowerPoint presentation. Okay, is it visible to you guys? Can you guys see it?
Yes, yes.
Okay, so let me start my presentation. So hello, good afternoon, everyone. Wherever you are, my name is Jonathan Febianto, and I came from Faculty of Medicine, Pelita Harapan University in Tangerang, Indonesia. And now I'm going to share a few bits about perspective, experience, and the situation of the medical field in Indonesia during COVID-19 pandemic. Okay, so for the background, the COVID-19, as we all know, is a contagious disease caused by SARS-CoV-2. And the World Health Organization declared the outbreak a public health emergency of international concern on 30th of January 2020 and declared as a pandemic on 11 March of 2020. The first case in Indonesia itself, it is declared at 2nd March of 2020, and the total cumulative case in Indonesia per 25 April is 1,600,041 confirmed cases. So as we all know from the timeline itself, from the 11th March, the WHO declares the COVID-19 as a pandemic. And then until April 2, the confirmed cases of the COVID-19 is top 1 million worldwide. And then on the August 11, the Sputnik vaccine received a regulatory approval and widespread use in Russia ahead from the publication of phase 3 trial results. And then next. So this is the current situation of the COVID-19 in Indonesia. So the confirmed cases is 1,600,000, and then for the recovered cases is 1,500,000, and for the death cases is about 45,000 cases. And okay, so as we all know, in Indonesia, the cases is like this. And then from the updates, we can see the distribution of the cases all around the provinces in Indonesia. Yes. Okay, next one. Okay, so the most common problems in medical field during COVID-19 pandemic in Indonesia is, the first one is, of course, the lack of health facilities and infrastructure. And then also minimal availability of ICU and ventilators for COVID-19 patients. And then also we lack of COVID-19 testing capacity, and also we lack of limited personal protective equipment, especially for health workers. And then we tend to like imports on drugs and medical devices. So these all problems could lead to high risk of infection and exposure to medical personnel. So the outcomes of the problem itself is, the first one, the Indonesia hospital is on the brink of collapsing. The health worker is all tired. And then mass graves, as you can see, the people are being buried. And then the pandemic puts Indonesia into the first recession in 20 years. So the outcomes of all these problems are really big. Okay, so I have a little video to show you the impact of COVID-19 pandemic in Indonesia. Okay, so let's continue to about my campus. So this is my campus building. It is Pelita Harapan University. And then this is my hospital of work today. And so, so we as a medical student are always obliged to wear our personal protective equipment during our working shift and wherever we go inside the hospital. And then the medical students and the clerkship students only permitted to enter yellow zone, which is the non-COVID-19 patient. So we have a minimal requirements for the personal protective equipment, such as the N95 or KN95 mask. And then we use surgical mask, and then we use goggles or face shields, and we use surgical gown, and then we use latex gloves. And then so for the vaccination program itself, our government are using Sinovac vaccine, which is from China. And it is our government is prioritizing a vaccination program for our healthcare personnel. So this vaccine itself is given twice with an interval of 14 days between shots. And then in my experience, the most common side effects that we experience are, the first one is feeling sleepy, and then the second one is minimal tenderness on injection site, and then the third one is mild fever. And then so in Indonesia, we have several diagnostic tests for COVID-19. The first one is, as you can see, it is the drive-through so the people could come with their vehicle to minimize contact with everyone else, and then the person in the protective suit will take the samples of your blood or your nasopharyngeal swab. And then this one is the COVID-19 rapid test. And then, so yeah, we have these 4 types of COVID-19 tests from the rapid antibody, from the ECLIA serology test, or we have the rapid antigen or rapid swab test, and we have the RT-PCR swab test. But we must know that the gold standard for diagnosing COVID-19 is through RT-PCR or swab test. Thanks. During this pandemic, I learned a lot in dermatovenerology department. I learned to identify, diagnose, and treat several skin conditions. And then I learned about skin infections such as bacterial, viral, fungal, or parasitic infection. And then I also assisting in several procedures such as cyst drainage and wood lung examination. And I also meeting so many interesting patients with different background. And then the next one is from the radiology department. I be able to learn and read radiographic findings on conventional imaging techniques such as MRI, CT scan, and X-ray procedures. And then also I found interesting cases of brain tumors such as meningioma or schwannoma. And then I learned about stereotactic surgery by gamma knife, and also the important one is to diagnose COVID-19 patient via thoracic CT scan. And then from the surgery department, I am currently finding a new interest in human anatomy, and I be able to recognize several gastrointestinal diseases and its surgical approach. And then I also learned how to do wound care in patients with severe conditions like diabetic ulcer, post-nephrectomy, and amputations. And also, I've been given chance to assist in major surgeries such as the first one is hemorrhoidectomy, incision and drainage of perianal abscess, exploratory laparotomy, sigmoidostomy, and stoma procedures, and elbow reconstruction using TBW. So the conclusion is, to this day, the pandemic itself is still heavily affecting our activities. And also the health system in Indonesia needs to be improved in terms of capacity. And then the third one is, as a medical student, this pandemic really impacts our daily life. And also, thank God our government prioritized safety and well-being of all medical personnel by prioritizing us in the vaccination program. And then, despite the situation, we are always eager to learn medicine, and fortunately, our hospital also designed as a safe working place. Thank you. That's all. Thank you so much for listening.
Yes, thank you, Jonathan, for your presentation. And we got a question for you. How did you go through restricting movement inside and outside of your country?
Okay, so for those people who were planned to travel to Indonesia, they have to do several tests, such as the PCR test, and then they have to go and inside our country and have to do the quarantine for 14 days. And then after that, they have to do the RT-PCR test again to ensure that they are still non-reactive or negative, and then they can go inside our country. Mm-hmm. And that's from the travel outside of Indonesia. But if we, as Indonesian people itself, if we want to go somewhere, especially go somewhere really far from our city, we have to do the same examination, such as RT-PCR, and the result itself is only qualified for one times 24 hours, so it's only available for 1 day only. So if we go outside for more than 1 day, we have to do the test again, so it's really complicated.
Mm-hmm. And what about vaccination? Is it necessary to enter the country?
Okay, the vaccination itself, So the government, our government, the first priority of the vaccination is for the medical personnel, such as me and my friends and my fellow colleague. And then the second priority group is for the older people, which is age over 60 years and more. And then the third priority of the vaccination is from the governmental person. So the person who works in a government office, they will get vaccination such as like police, like military, and like government. Yes.
Yes.
I also have a question for Jonathan. Maybe I've missed that, but how many vaccines do you use in your country, and which and from which countries are they?
Okay. So the vaccinations that we use, the first ones, the first batch of the vaccine is the CoronaVac or the Sinovac from China. It is used to mainly vaccinate the healthcare personnel. And then we also have more vaccines, such as our government made itself. It is called Vaksin Merah Putih. It is made from our country, but the ingredients came from China. So the viral part is kept from China, and we produce it to vaccinate our people. Yeah, we still don't have other vaccines such as Pfizer or AstraZeneca or Johnson & Johnson, but I think there's only 2 types available.
Okay, thank you.
Is there any questions for Jonathan? Okay, thank you, Jonathan. We continue. Continue our session, the next report. Please welcome our next speaker, Ana Beatriz Sabina Pereira, a student from Brazil, Anápolis, Centro Universitário Uni-Evangélica, and to talk about COVID-19 pandemic in Brazil, impact in a medical student perspective of the reality and future.
Good day, everyone. My name is Ana Beatriz. I am a 60-year-old medical student in Uni-Evangélica Medical University in Anápolis, Brazil. First of all, I would like to greet everyone here and thank you, Dr. Marina Antolievna and Dr. Natalie for offering me the great opportunity to be part of this, and even from so far, being able to share with all of you the reality in Brazil and to get to know closely more about the situations in other parts of the world. I would like to start with a quote that I really like, that is from William Osler, and he says, "By far the most dangerous foe we have to fight is apathy, indifference from whatever cause, not for lack of knowledge, but from careless, from absorption in other pursuits, from a contempt bred of self-satisfaction." And if this pandemic showed me something, is that we, in all our seek of knowledge in the path of becoming doctors, sometimes get lost in the way to our empathy, and mostly of all to our patient soul. Before starting showing numbers of cases, deaths, and vaccines, I would like to remember, as I am always remembering myself, that these aren't just numbers, they are lives, and for sure someone's beloved one. And in Brazil, as you can see, the number of cases has been drastically getting upper nowadays. This is the number of cases, confirmed cases, recovered cases, and in following up cases. This graphic shows the newly cases that we had from March, from the last year till now. And as you can see, this year is very worse than last year, with the higher in the number of cases, mostly on March and April from this year. as well, the number of deaths by COVID are getting higher. This is from some reasons. The first one is the collapses in the health system, and another one is, as we can see, we have the greater capacity to get used to things, even when related to deaths. So thousands of deaths in one day is not as impressive as it was last year. And this is one of the reasons why society became careless and indifferent. And another point is that we have to fight against the health crisis here and the economic collapse. So last year, when the first case was reported in February, everyone was so worried about it that they stayed in the lockdown, everybody in their homes. So everything stopped. And we were able to minimize the transmission of COVID. But nowadays, this isn't possible anymore because people are need to work. They have economic crisis and they have to get money to buy food. And the mostly prejudiced people were the poor ones. So we can see now that although the number of cases are getting higher, people aren't staying at home anymore. And this is the thing that we concerned more, is the ICU COVID beds occupation rate. As you can see, in the beginning of last year, it was mostly just alarm alert. And nowadays, this last picture is from last month here. And the rate of occupation was really, really high. And the mostly thing that we worry is that people that get COVID don't have how to get health service and to being taken care of. So they are staying at home until the last minute. And when try to get to the hospital, we don't have ICU beds. And just to stay in the hospital isn't working. We are really getting hope with the vaccine. In Brazil, we have two kinds of vaccine. One of them is AstraZeneca, and the other one we called Coronavac. It was developed here in Brazil by Butantan Institute, and people here are getting vaccinated in groups of priority. I saw that in mostly countries it has been like this. The health workers is the first one to get vaccinated, and then by age. And the vaccines are being distributed by each state. So it's up to each state how they are going to get people vaccinated. And here we get some anti-vaccine movement, and it's really hard because we have to convince people that vaccine is good. And this is the percentage of people in Brazil that has been vaccinated. These are from 20 of April. And only 5% of all population had get both doses of the vaccine, as we are a very large and populated country. So what about the medical students? We are neither doctors nor students. I am in the sixth year now, but in the beginning of pandemic, I was in the fifth year. And it has been up to each university how to deal with it. In the beginning of pandemic, everyone were closed at home and all the activity stopped. But then each university decided when it was the time to come back. Individual protection equipment should be offered by the university, but we also have the background from the hospital that we are working it. The country launched the program Brazil Count on Me. It's a government paid program to recruit medical students who wanted to work in the front line, and it was ended in 1st of January this year. I applied for it, but I wasn't called, and but lots of students had the opportunity to work in the front line and then use this work to the university and as an internship in the university. And I can see the very difference between newly entered students in the basic cycle and students in the internship. I think of them, the newly entered students are really getting used to getting classes, online classes, and that's fine. They have time later to get back to the practice. And but the basic cycle is really been prejudiced by this because they don't have practicals. They are just online, having online classes. And when they enter the internship, they will have very difficult to get in touch with patients. I was in the internship, so I don't think I missed it too much because when the hospitals came back and the active came back, I started again as normal as it can be at this time. So since March from last year, I am going to hospitals and attending to patients. So I think it's a good thing, a good point here. And in this year, we had a new standstill because of the lack of vaccines. So university had to stop again, but again, I didn't stop. Okay, in my reality in the pandemic world, I can divide in two topics. It's mental health and a doctor to be. In mental health, I think the worst of all is the anxiety of staying isolated and away from a family and my friends. As I study in another city, I didn't came home in a long time of period. And the feeling of impotence for not being able to help. So we went to the hospitals, we see patients there, and we couldn't do anything to help them. And worrying about where I will be next year when I do not even know about tomorrow, because in the next year I will enter the residence, is the specialization. So I have to study for this, but between this, I am worthy of everything that it's happening here, and how we get used to every situation. This is our new normal: to wear masks and to not hug people, to not meet our friends and our families, and it's strange to think like this. And in a doctor to be, we have to choose between following up my graduation and exposed my loved ones to a situation of risk, because the university gave us the opportunity to say, no, I'm not comfortable to go into hospitals right now, but then I would have to work more to get these hours back. So it was very difficult to decide to go back to hospitals and stay away from a family and not meeting them, because I didn't want to get this to them. And the possibility of getting graduation without knowing the basics, because I feared that we didn't have everything that we needed to get graduation. And here we have these anticipated graduations going on, because it's in need, the country is in need of doctors, and universities are allowing students in the beginning of the fifth year to get graduated. And another situation that changed my life, it was taking care of my father in the ICU. And it was very difficult in this moment when I saw uh, his evolution. So I feared so much, and I say that this is the moment I prefer not to know medicine, because I saw the images of his lungs and it was not very good. But in this, we trust that he was good taken care of, and now he's very healthy, thanks to God. And what do you think about the future? I am very optimistic. I try to stay focused on good news all over the world, in countries that are already open to travelers, that people are walking in the streets without masks. And I found out that to be a good doctor is about staying next to your patient, even when this is the only thing you can do for it. So, for him. So I learned it from it, and I really expect that in my career as a doctor, I always remember this. Thank you very much once again for the opportunity, and I am open to any questions.
Thank you, Anna. I'm so touched by your report. It was really brilliant. Thank you very much. And I have questions for you. Did you feel ready when you started your clinical work with COVID patients? And what qualities do you think are helpful for the young medics to work there in the red zone?
Well, I didn't feel, and I don't feel ready to work with COVID patients, because I think it's a new word, a new sickness, so we have to study a lot to take care of them. And I can see that here in Brazil, as people are in need of new doctors, newly graduated, and a lot of students are going to the ICU to take better care of the patients. I think this is really neat, but I can see that this is making difference in the perspective of life of our patients. My brother is a medic. It's a doctor, and he works in the ICU of COVID, and he studies a lot, and he really takes care of his patient. It's like beautiful to see him in the hospital, because he talks and he cares about the patient. And I can see that the rate of deaths in his ICU is really lower if we compare to others ICU. And I am actually really sad, because with COVID-19, we can deaths in a night shift, it's getting normal. Like 3-4 deaths is they are normal, and the doctors maybe are getting used to it. So I think I have to study a lot and to practice a lot before going to take care of COVID patients.
And I also have a question. You've mentioned about the issues of mental health. And do you think that it's important to the doctors to visit a psychologist when you when you work in the red zone? And how do you think about what do you think about the prejudice against the psychologists and visiting the psychologists during that hard time?
Yeah, well, I think it's extremely necessary to see the psychologist, because we are struggling to stay healthy in this situation, because we see lots of bad things and people suffering. So we have to be good with ourselves to being able to take care of others. And I think doctors are really blocked to go into psychologists and people in general. But I think this is one topic that should be mentioned in all our graduation, because it's not just in this pandemic that we have to take care of this. We take care of lives, we see deaths, we are in touch with death all the time. And we are not prepared to this. We just pass through it. So I think it should be discussed more. And I think maybe we should have background support, and mostly in these times that we don't have our family support with us. So in our university, we have an institute with psychologists and with teachers that are up to help us when we are struggling in studying and other things. So I think it's a good thing.
Thank you.
Thank you,
welcome.
Anna. Can I make some comment, please? As I love this girl,
course.
so I can't not to comment. You're always been an optimist, and we want to be an optimist too.
Yeah.
And we are waiting for you in Russia, in Yekaterinburg. So we to visit us after this whole
Yes.
situation. Okay. Thank you.
No, I really love you, Natalie. Thank you.
Thank you. Do we have another question? So I think not. Here now we are presenting Mikhail Poroshin and Olga Popova, whose report is dedicated to the preventive COVID-19 volunteers.
Okay. Good afternoon, dear colleagues and dear professors. I want to present to you my report, Preventive COVID Volunteers, Who We Are and Our Role to Fight Against Viral Infection. I'd like to start my report with a small excursus on preventive medicine on the territory of the Russian Federation. Rospotrebnadzor, it is a federal service for supervision and consumer right protection and human welfare, is successfully operating in the Russian Federation. The service carries out social and hygienic monitoring, sanitary and epidemiological state supervision and control, organization and conducting of anti-epidemic measures, supervision and control of consumer protection. The federal service carries out its activities directly and through its territorial authorities in cooperation with other federal executive authorities of the constituent entities of the Russian Federation and other organizations. Preventive medicine faculty trains doctors to work in Rospotrebnadzor. We are very proud of this fact and couldn't stand aside when COVID attacked society. On the 25th of March, high alert mode was introduced in all regions of Russia. All public events were cancelled, educational institutions switched to distance learning. In Sverdlovsk region, by the decree of the governor of Sverdlovsk region number 100 UG, date 18th of March 2020, restrictive measures were introduced due to the steady increase in the incidence of new coronavirus infection. The rapid deterioration of the epidemiological situation on the territory of the Russian Federation and Sverdlovsk region too, the high workload of the employees of the Rospotrebnadzor requires the involvement of new powers to combat coronavirus infection. In the context of distance learning, students of the medicine preventive faculty of the Ural State Medical University were involved as volunteers to prevent the spread of a new coronavirus infection. Within the framework of the assistant, contacts with infected people was not provided. The work is carried out using technical means and includes registration of patients, keeping registers, adjusting and recruiting current documentation, calling contact people, and so on. This work is carried out in all territorial departments of Sverdlovsk region in the cities of Yekaterinburg, Nizhny Tagil, Serov, Kushva, Kachkanar, Asbest. This activity required constant monitoring and control. In this regard, an innovative approach was developed, which was implemented through the creation and configuration of a timesheet on the Google Sheets platform. If you are interested in, after my presentation, I'm ready to explain to you how the monitoring and control of volunteers' activities were carried out in the sheet. For the period from the 28th of March 2020 to the 28th of April 2021, the total working time of volunteers was 14,500 hours, or 1,812 of 8 hours shifts. All the information is available for the heads of the departments, employees of the training organization, and headquarters of volunteer medical. Due to the necessity for duplication and transfer of data is leveled, which allows you to use it quickly. If it is necessary to confirm the date, weekly reports or to basic managers are provided. They are the primary sources of the verified date. High efficiency of work was achieved due to the implementation of the accounting system presented in the project and its focus on the target group. The flexibility on the schedule and the ability to independently determine convenient days for work made it possible to successfully combine study with the use of DET and volunteer activities. And the general access to viewing the report card and multi-stage control excludes the data spoofing and became effective preventive measure for unfair activities. These advantages were achieved due to high-quality interaction between the Ural State Medical University and the Rospotrebnadzor in Sverdlovsk region and the student community. Conclusions. The introduction of a shared timesheet on the Google Sheets platform made it possible to organize the work of volunteers with the greatest efficiency. This form of organization is convenient for use, both for student volunteers and for coordinators and heads of departments, employees of the educational organization, and headquarters of volunteer medical. The introduction of this work allows students of the Faculty of Preventive Medicine faculty to immerse themselves in their future profession more detailedly beyond to the educational program, which in turn significantly improves the quality of education. Thank you.
Thank you, Mikhail. And we've got some questions for you, if you're ready.
Yes.
Please tell us how many volunteers participated in the project, and do you plan to continue your work?
Yes, 155 students were involved in our work, and they increase every day. And yes, we are planning to enlarge our resources and large-scale aims.
Thank you, Mikhail. Is there any questions from speakers, maybe? No, okay. And now, last but not the least, I'd like to present Polina Berskevich, Ekaterina Mylnikova, and Ksenia Sorokina with the report COVID-19 Denialism in the International Community.
Hello, dear colleagues. Today I would like to present you the theme COVID-19 denialism in the international community. In this slide, you can see the epidemiology in the world on the 29th of April. So COVID-19 denialism in the psychology of human behavior. Denialism is a person's choice to deny reality as a way to avoid a psychologically uncomfortable truth. The term COVID-19 denialism refers to the thinking of those who deny the reality of the COVID-19 pandemic or deny its cause in the deaths, which was scientifically proved by the World Health Organization. Reasons for COVID-19 denialism. The first is underestimating the significance of the problem. Paradoxically, the readiness of people to believe in conspiracy systems of management is connected with distrust. Distrust as a defensive reaction of a person, it is associated with psychological portrait of deniers, a high level of powerlessness, anger, as well as a low self-esteem or psychological problems. A lack of knowledge about reliable sources of scientific information. These are questions and we don't know how to answer them. It creates a gap that should be filled with something. So some people who are aware of politicians, scientists, or doctors try to fill this gap with the conspiracy theories. Believing conspiracy theories calls people down, and evaluation of new knowledge plays a great role. Experts in psychology identify 5 stages of assessment. The first is people determine if new information is compatible with their existing beliefs. Then they assess whether the facts agree with each other. Next, people pay attention on the other's feeling about a particular news. And they analyze the evidence and finally determine if the source is credible. Then some people start searching for additional facts. Scientists call this process an analytical strategy, which requires efforts from a person. Others rely only on subjective experience. This is called an intuitive strategy. Here is a running list of disinformation spreading about the coronavirus. People had eaten bats in Wuhan. The biggest piece of misinformation about the cause of the virus is the widely circulated video of a woman eating a bat. Bats could potentially have been the source, but the video was not filmed in Wuhan restaurant as had claimed, but in Palau, Micronesia, as a travel video in 2016. It is a deliberate plot. The theory suggests that the disease was planned and fabricated. It is a bioweapon. The Washington Times claimed in a story that the coronavirus outbreak could be linked to the Wuhan Institute of Virology. But a number of experts analyzed the base of the genome of the virus and concluded that it was not engineered. 5G caused the spread of coronavirus. 5G is a new generation of mobile communication that aims to expand the possibility of internet access via radio access networks. Wuhan had become the first place in China where 5G was rolled out in 2020s. There are no evidences that 5G weakens immune system or is harmful to humans. Oregano oil, vitamin C, or salt water will cure you. A high number of people around the world believe in conspiracy theories. Some believe that the danger of COVID-19 is greatly exaggerated. Others are convinced that the coronavirus does not exist at all. So in this slide, you can see statistics of denialists around the world. In Russia, from the end of December to the end of May 2021, specialists from the High School of Economics conducted a massive internet survey. They asked more than 30,000 people from all regions of Russia, aged from 20 to 60, and it was turned out that 32% of them are COVID denialists. 23% are generally sure that there is no epidemic and it is only a fable, and 9% of respondents simply believe that the danger is clearly exaggerated. Assessment of expert and control methods. The problem is that it is difficult to analyze tangled thoughts. Believing conspiracy theories allows people to feel superior, self-respectful, and it is not easy to give up. Dr. Dovan Byford sums up, if you want to talk to conspiracy theorists, your goal is not to make them less curious and skeptical, but to change the direction of their interest. When we analyzed the Paul's-Burton scientific work, we concluded that when people evaluate information at the stage of dividing into people with an analytical and intuitive strategy, we need to persuade people to search for additional facts. Also, it takes a lot of efforts. To solve this problem, we suggest the following. While searching for the information about COVID-19, use only trusted sources with scientifically proved. The second, health workers must be aware of new information about coronavirus infection, because in the pandemic, new scientific research and statistics of COVID-19 are updated every day. The main task of medical professional is to find an approach to patients and create faithful relationship with them to share scientifically based facts. The task of the state is to block fake information about COVID-19 in the internet and on television as soon as possible to prevent its dissemination among the population. Vaccination is a victory over the pandemic. In Russia, the super job recruiting company interviewed 1,600 respondents, and only 22% are ready to be vaccinated with any of the registered vaccines. In the United States, according to the inquiry by the Associated Press, it has become known that half of Americans are ready to be vaccinated. Many were embarrassed because of lack of data on its effectiveness, as well as the fact that the vaccine was created fastly and the possibility of its side effects. Experts remind that to achieve herd immunity, about 70% of the world's population must be vaccinated. Some facts about vaccine. Scientists conducted trials firstly. They tested samples in laboratories, conducted tests on animals, and only then on humans. Additional verification of the obtained result was carried out by regulations such as Ministry of Health in Russia or Medical and Healthcare Regulatory Agency in UK. Possible side effects when using the COVID-19 vaccine are painful place of the injection, headache, muscle pain, chills, fever, or tiredness, but they should completely disappear in a few days. The same side effects can be observed after ordinary vaccines, which are taken into the national immunization schedule. Yoel Maldonader, an epidemiologist from Stanford University, said that most vaccines cause minor side effects. Basically, there are the body's immune and inflammatory responses to the vaccine. This is the very immune response that is needed. In this slide, you can see actual information about several existing vaccines. The scientific community is confident that the only way out of the pandemic is vaccination. According to the latest WHO data, more than 60 vaccines around the world have been already undergoing clinical trials. More than 170 are tested on animals. 22 drugs are undergoing tests on the final phase. 3 of them are Russian-made. And again, vaccination is a victory over the pandemic. Herd immunity is necessary because some people cannot be vaccinated for medical reasons, such as allergies, immune problems, or other diseases. Older people often don't have a strong immune response too. It is important how quickly we achieve herd immunity, because in a pandemic, time is life. If it takes a year to achieve herd immunity, it could be thousands or tens of thousands of lives in one country. And as Dmitry Ivanovich Mendeleev said, science fights against superstitions like light against darkness. Thanks for your attention, and open for questions.
Thank you, Polina, for your very interesting report. And I have a question for you. What do you think, how the doctors should work with COVID-19 denialists?
I think that all doctors must help them to change their direction of interest, because maybe they don't have good information, not good, maybe scientifically based information. And our aim is to help them to find it and to have a good relationship with them for this. Because if we have a quarrel with them, it is not a decision of this problem. We must just.
And another question for you: have you vaccinated yourself, and what do you think? Do you promote the vaccination?
Yes, I have been vaccinated, and I think that it's the only way to be a winner in a pandemic. And I think that we must be the first who will have this vaccine, because we are medics, we are doctors, and it's our main aim in our life, I think.
Thank you. Do we have other questions?
I would like to make a question. First of all, congratulations for your presentation. I think it's a topic that it should really be discussed. And do you think that the way our politicians stand up for vaccine and for COVID impacts the population view of it? Because I can see in Brazil that our president is a denial. He thinks that it's not that it's overviewed, the COVID-19. So what do you think about it?
I can't decide for all countries. I think that it depends on our politicians, but I think, yes, that politics must help doctors to fight with this problem. And for example, in Israel, I have a friend from Israel, and he told me that all of them are vaccinated. And if they don't have a vaccine, they can't go, for example, to the restaurant, or maybe they can't go in public transport. And maybe it is a decision of our problem. But I think that politics, not politics, maybe all people mustn't listen for fake information, because a lot of people hear it and then they tell about it for the auditory. For example, in Instagram, popular bloggers who have a lot of followers, they tell about it, but they don't know that it is true, what truth, what is not truth. I think that it is very important for us.
Yeah, I totally agree with you. Thank you.
Thank you.
We're waiting for another question, guys. We haven't got any questions in YouTube comments. So if we haven't got questions here, dear colleagues, our symposium, International Experience of Young Medics Fighting COVID-19 is over. Thank everyone for participating, and we should point that we need to share experience, our knowledge across the borders, and thank for all of you for this. And we hope that it was interesting and inspiring for you all, and hope to see you soon. Bye.
Thank you for organization.
Goodbye. We hope to see you soon, and take care of yourself in this hard time. I hope that all of us will be well. Thank you.